The COVID-19 pandemic began at the beginning of 2020, and since that time, contact tracing has been an important factor in keeping the number of cases at a minimum in any given community. SRMT Director of Health Services Michael Cook spoke with us about the basic definition and when contact tracing kicks in.
Contact tracing is the virus is identified with an individual or an event to identify as many people that were potentially in contact with a positive case. You're theoretically, within hours of that test, you are contacted by the county to let you know that you have a positive test. In some ways, we may be duplicative of what the county's doing, but it's more personalized when we do it ourselves, because we know our community.
The contact tracing process is about keeping people informed, actually connecting the dots, and taking necessary measures to stop the spread of the virus. SRMT Health Services contact tracer Lynne Thompson gave us a sample of how things are broken down.
As it relates to COVID-19, it's basically to identify anybody who has come in contact with an infected individual and collect further information like where they may have come in contact with that person, the date of exposure, things like whether they were wearing a mask, were you wearing a mask or the other person wearing a mask, were you within outside of the 6-foot distance, where you're social distancing basically. The key to helping to slow the spread of the COVID-19 by identifying those individuals and getting them quickly quarantined or tested and quarantined and doing all the things that the Public Health Department requires us to do.
Whether you're contacted by SRMT or MCA Health Services or from the Public Health Department, it's important to give all pertinent information. And if a positive exposure is determined, a healthcare provider determines when you'll be tested, Lynne explained.
We get a lot of calls because people are really worried. But again, there's some people who want to get tested just for peace of mind. So we'll say, well, where do you want to go? Do you want to go to Messina? Do you want to go to Malone? Whatever's easiest for you. I don't decide who gets the test. I run everything through the providers, whether it's Teresa Gardner or Dr. Kelly or any of the other nurse practitioners there.
Ultimately, it's about accountability and full disclosure. And as Michael Cook explains, Akwesasne has been successful in battling the virus, but it's all about humanity and the care we take with one another.
Nobody does it intentionally. You really have to have some sensitivity and compassion. It all comes down to self-compliance. We really need you to follow the guidelines that are out there by the health professionals. Well, we're doing tremendous. I've gotten calls from other tribal groups across the country saying, "What are you guys doing?" Because our numbers are just tremendously low. We're very, very fortunate. So that gives the credence to what our staff is doing, what the council leadership is doing.
For Akwesasne TV, I'm Louis Jacobs.